The system is not set up to reward prevention. The system is set up so that doctors are well compensated for treating conditions. So are pharmaceutical companies. We mainly have a disease industry in this country.
We've got a healthcare system that's out of control, spending an incredible amount of our national wealth, not making people better. We've developed a system that's based upon putting out the fires, taking people with chronic diseases and doing all these things to them.
There is just not nearly enough attention paid to trying to help keep people from getting sick, from getting congestive heart failure, from getting the kinds of illnesses that require stents and being put on maintenance drugs and having expensive care for the rest of their lives. They don't want them to die, but they don't necessarily want them to get better.
Well, that's where the money is. It's like the Willie Sutton law.
It's Sutton's law. When asked Willie Sutton, why do we rob banks? He said, that's where the money is. So the insurance companies are following Sutton's law.
You don't get to be CEO of a company because you've saved lives.
The cliche runs that the darkest hour is before the dawn. 2012 proves the cliche is right. Despite the fact that most insurers still won't pay for it, more and more people are going for a scan. After sewing up a big business deal in the US, Irish entrepreneur David Bobbitt went to have a medical checkup. Part of it, a coronary artery scan. He had the shock of his life.
My arteries were that of an 86-year-old. So here is a 51-year-old who exercises every day, is careful what they eat. My parents lived into the 80s. I'd done all of the things you were supposed to do to be healthy. The following day, I had to go in to do an angiogram where they found I had one totally blocked artery, I had another artery that was 70% blocked, and I had a huge level of disease right throughout my system. And the clear suggestion was I was either going to have stents put in or a bypass. The shock of it, the shock of suddenly going from one day feeling absolutely perfect with no reasons of any issue at all to a situation that 75 out of 100 people at your level of calcification is going to either be dead or have a heart attack in the next 10 years.
The disease has barely advanced. David's still in a very high-risk group, his arteries still very much blocked. But for now, there's real hope he can make it.
The fact that I could be around like any father wants to be with his kids. The fact that my daughters, that I just so special that I would be there when they got married or when they were that bit older, that I'd see my grandchildren. That gave me hope. That really was what really was so important, why I wanted to fight this as hard as I did. And I would fight because it was important to me.
Without the shock of that first scan, David might not have changed his life around, might not have been here today for his family. But now the hope he has can be shared by millions. While astronauts and Earthlings aren't so different.
Well, the family history has always been horrible. It goes back a few generations. I have the disease and it's extremely aggressive. My body cannot synthesize the good cholesterol you need or rid itself of the bad cholesterol. My first open heart surgery was at the age of 38, and my second one would have been about 51.
Rene has a double bypass in 2007, which saves his life. The surgery is prompted by a scan which shows a 90% blockage in one artery. After 2 conventional tests, an EKG and a stress test, had said he was completely fit.
I have a very low opinion of an EKG. I've had 2 EKGs that were absolutely told me I was fine when I wasn't, when I was, in fact, very near death. So to me, I tell people, if you're going to rely on an EKG, you might as well just flip a coin. Sophistication now with CAT scans and getting the calcium scoring and these other things is just really critical.
5 weeks after his surgery, Rene starts a crusade. He's a Texas senator.
Our Texas Constitution says we get sworn in at noon, dead up 12 noon like a cowboy movie. And I wanted to send a message out there.
He drafts a bill that will force insurers to pay for the screening of all Texan men over 45 and all women over 55.
It's really hard to rock the foundation of the insurance industry and even public opinion on a lot of things. But I felt the only way was to mandate these tests. I was facing very powerful business interests, divided medical community, insurance companies, and those are probably the 3 most powerful groups, except for maybe some oil and gas people in Texas.
Mr. Speaker, members, can I get your attention?
Doctors came up to me and said, this is just a bill to help a couple of vendors out on this. I said, no, Doc, let me tell you my story and why I believe in this. It saved my life. And if it saved mine, it can save others. Any tool that helps us detect it is worth it, particularly as inexpensive as this test is.
All those in favor say aye. All those opposed, nay. Ayes have it. House Bill 1290 is passed and engrossed.
After 2 years of furious debate, victory. Rene Oliveira's bill passes in both Texas houses to the intense and enduring disbelief of its opponents.
0.25.
There's one last key opponent, the insurance industry. They won't pay for the test. Ironically, the headquarters of giant health insurer Kaiser Permanente are just across the bay from the offices where the very first scanners are installed. In the early 1980s, the Kaiser board come calling.
We met with the Kaiser executives. Of course, most of them came in to be scanned. And some of the Kaiser researchers did some excellent research on coronary calcium screening, published research.
But that didn't mean they'd pay out for their policyholders to have one.
They said, we're not interested because our typical patients are only in the plan for 5 years or less. And this is a long-term cost savings. And so the cost savings will go to our competitor. And no need to single out one particular health maintenance organization. All the insurance companies told us basically the same story, that their patients are not long-term holders of that plan. So if they reduce cost over the long term, it means nothing to them. It only goes to their competitor.
We contact the big insurance companies, Kaiser and the rest, to find out why they will still pay for a $50,000 stent, but not unless you're very lucky, a $100 test. But they won't talk. In the 30 years since coronary artery scanning was invented, over 4 million people have died without any warning. That's the equivalent of half the population of New York City dropping dead. And most of these people could have been saved.
You know, the number one killer today is heart. And number one killer in 1940 was tuberculosis. And that was completely eliminated by X-ray screening of the chest, the famous chest film. So to me, being a poor physicist, it was the same. Let's get rid of heart disease because heart attacks are completely preventable. So let's find out who is on the road to having a heart attack, screen them, and eliminate it.